Today, I want to talk about the explanation regarding the lowest incidence of heart attack experienced by a tribal group in the Amazon forest area of Bolivia. This explanation was presented by Dr. Sanjay Gupta, a CNN medical correspondent, on April 21st, 2019. Hello, I am Dr. John. I have been studying food intake and related complications such as obesity, diabetes, and cancer for the last 30 years. Dr. Gupta in his presentation found that the tribal people slept for 9 hours every night. However, they exercised during the daytime to the tune of 17,000 steps on an average day. Their food intake consisted of almost 70% of the energy coming from complex carbohydrate, rice, corn, and cassava, which is similar to potatoes. Compare that with the modern day intake of 50% of energy coming from complex carbohydrate, primarily from grains in developed countries. But before you feel comfortable, let me present these points. About 60 years ago, we had the Green Revolution. Soon after that, government subsidized agriculture and farming of grains to the tune that food made with grain and grain flour products became the cheapest available. Soon thereafter, we started having the obesity epidemic. Why? Because when the grains are digested and absorbed into the body, it is glucose. This glucose stimulates your pancreas to release insulin, the power within, if you will. But insulin instructs the liver to convert that glucose into fat. In some people, this insulin can damage the lining of the coronary artery, where now the fat can stick and cause a heart attack. The second finding in the Bolivian group was almost everybody has a parasitic infection. So the question is, did the immune system acting on stimulation of parasites protect in any way? But the point I would like to make is the immune system reaction to a parasite is similar to what happens in a person with allergies and asthma. There is no evidence to suggest people with allergies and asthma have a lower incidence of heart attacks. In summary, if you want to prevent a heart attack, I recommend that you reduce the intake of energy from grain and grain flour products to less than 30% of average daily energy intake. Why? Because that will reduce the amount of glucose in your blood, which in turn reduces the amount of insulin, because insulin is contributing to most of the problems experienced by people with obesity, type 2 diabetes. If you are not convinced with what I'm saying, consider this. Insulin promotes growth of cancer. All I am interested in is share this information. So please spread it to others. Follow us on Instagram or on Facebook, Dr. John on Health. Thank you.